Well, Cheryl, the CDC advisory panel is now recommending that Americans get the COVID vaccine shot based on personal choice, which experts say could lead to clinicians not carrying the product. But this conversation around vaccines overall is creating confusion among parents on a variety of vaccines for their children.
Those with the American Academy of Pediatrics say the impact of CDC recommendations on child vaccines are having a real-time effect.
Today, I heard from a colleague seeing patients in primary care about a parent refusing MMR vaccine.
There hasn't been any real, besides COVID, any real pandemics. But we're seeing more and more of that as more parents are not vaccinating their children.
Chicago mom and healthcare attorney Anjali Dooley says she worries that the wrong information about the safety of vaccines is spreading.
I think the new pressure for new moms is very, very unfound, to be honest, when there's data there that says that for years it's been good to have these vaccinations done.
In addition to no longer recommending the COVID vaccine, the CDC Vaccine Advisory Panel decided to delay a vote on whether to stop recommending the hepatitis B vaccine for newborns. The panel had argued the changes will improve children's safety. Others disagree.
Hepatitis B vaccines have been a substantial public health success. The largest concern right now is that there's a lot of solutions being presented that don't have problems.
This comes after the panel voted Thursday to change a recommendation on the combined measles, mumps, rubella, and varicella, also known as the MMRV vaccine, supporting separate instead of combined MMR and varicella shots under the age of 4.
I do worry that parents may choose to defer one of those vaccines to avoid those two separate injections at that visit, which could leave that child at risk for one of those potentially deadly viruses.
When I was a young mom, that was what you did. You got vaccinated. You vaccinated your children. You take care of your children. To me, this is not taking care of our children.
The American Academy of Pediatrics was asked if they would take any legal action if the Vaccines for Children's program would not be able to provide the COVID vaccine. They said it's possible that that could be added to a number of lawsuits that are already in the works, guys.
All right. We'll be following every one of these details. Parents need to know what to do.
Yeah, absolutely.
Thanks so much, Jasmine.